I'm Ryan Donegan. I'm an orthopedic surgeon, shoulder and elbow specialist at Bluegrass Orthopaedics. Injuries to the rotator cuff are something I see very frequently here at Bluegrass Ortho. It's a collection of 4 muscles and their associated tendons that come from the shoulder blade and attach to the ball and socket joint of the shoulder. So the role of the rotator cuff is to provide stability and balance to the shoulder. When we go to lift our arms, like we do every day, the rotator cuff fires and provides stability to allow us to get our arms up over our heads. Rotator cuff tear is actually just like it sounds. It's a small tear of not the muscle, but the tendon that attaches the muscle to the bone within our shoulder. It's extremely common. We tend to see it more as we age. Degeneration of the rotator cuff tends to create a tear. I think there's a common misconception that patients need to have some sort of trauma, a fall, or some sort of mechanism of injury to create a rotator cuff tear, whereas most of the rotator cuff tears that I see happen in people who are over the age of 50 or 55, and they're the consequence of just degeneration and aging. Probably the most common symptom, really for any shoulder condition, but most notably rotator cuff tears, is sleep disturbance. At night, for some reason, patients who were doing well during the day could tolerate symptoms, maybe the little bit of pain they were having. When they go to lay down at night, they have significant pain, inability to sleep. They're up every single hour or every couple of hours with significant pain in their shoulder. The other thing I commonly see is our rotator cuff muscles act and engage pretty significantly when we go to reach out away from us. For example, if I were to reach out in the refrigerator and try to lift a half gallon of milk and go and put it on the counter, that's when the rotator cuff engages significantly, and as a result, patients have significant pain doing activities out away from their body.